Hi, everyone, and welcome to the Functional Solutions Podcast, where we cut through the noise and get to the root causes driving chronic disease in your patients. I'm Dr. Asia, and today with me is Dr. Chil, my colleague and an experienced functional medicine provider. Hey, Dr. Chil.
Hey, Dr. Asia. Happy New Year. It's great
Happy
to
New
see
Year.
you.
Same. We're so excited to chat with you all tonight. If you're here, you've probably noticed that when we only focus on treating symptoms, many patients continue to struggle. And this is where understanding the underlying dysfunctions, how to find them, how to treat them can make a world of a difference. Today, we're tackling weight gain and obesity. And we all know these patients, they're eating clean, they're exercising regularly, compliant with their medications, and yet they still cannot lose weight. They're exhausted, they're frustrated, and nothing really seems to work. So we're going to dive into one of the most overlooked drivers of metabolic dysfunction, which is HPA axis dysregulation. So it's not really about telling patients to manage their stress better or, meditate more, things of that nature. We're more so exploring how chronic HPA axis dysfunction actually is going to rewire metabolism at the hormonal level, driving weight gain, insulin resistance, and that stubborn treatment resistant phenotype that we so often see in practice. So by the end of the class, you'll have practical evidence-based strategies to assess and address that HPA dysregulation in your patients, because understanding these mechanisms can transform both your patients' lives and your practice. So just to kind of start with a little bit of backstory here, let's start with the scope of the issue. In the US, over 73% of adults are either overweight or living with obesity. So this looks like 42% actually meet the criteria for obesity alone, which means that most adults are dealing with excess weight, metabolic strain, or both, often long before they meet diagnostic thresholds. And that's a lot of my practice is metabolic dysfunction. So I'm really familiar with this topic and these stats. Over the last few years, we've seen a surge in the pharmacological options. We know the GLP-1s are super popular, the GLP-1 receptor agonists, very, very popular. Patients are looking to dose those, microdose them, regular dose them. These medications are helpful, right? But they're not necessarily without challenges. Many patients who use the GLP-1 agonists have GI side effects, nausea being the most commonly reported, but there's a slew of other ones as well that I do hear of as well in my patients. So importantly, when these medications are discontinued, the weight regain is common, reminding us that underlying biological mechanism has not actually disappeared. That's driving the weight gain. So this is where stress physiology becomes critical. So chronic stress is not just going to affect the mood. It changes how the body's going to regulate glucose, appetite, fat storage, and energy expenditure. So we've been mentioning the HPA axis. What does this stand for? So the HPA axis stands for the hypothalamic pituitary adrenal axis, or the HPA axis, which is the body's central stress response system. So let's take a look at this image so we can see how it all works together and how it's activated by stress. So you'll see the hypothalamus here at the top in the brain, right? So that's regulating or releasing that CRH, which is corticotropin releasing hormone. This is going to go to the pituitary. It's going to tell the pituitary to release ACTH, which stands for adrenocorticotropic hormone. This ACTH is then going to go to your adrenal glands, right? And that's where you're going to have cortisol produced. So the adrenal cortex is what's producing that cortisol. So cortisol, it's essential for survival, right? It's going to mobilize glucose, it's going to support our blood pressure, and it helps us respond to acute stress. The problem isn't really the cortisol itself, it's when it's chronically activated, which probably is the bulk of all of our practices, honestly, that chronic activation of that stress cortisol mechanism. So when the stress is persistent, cortisol signaling begins to influence our metabolism in ways that pretty much are going to favor fat storage insulin resistance, and then central weight gain. So we definitely want to understand these mechanisms and how we can support our patients, especially the ones that are of the metabolic category, which is a huge driver of disease in America. So this is a really important topic. We're going to talk now about how stress, kind of the physiology of stress, is going to contribute specifically to weight gain. So I'm going to pass it over to Dr. Chil, and he'll break that down for you.
Great introduction, Dr. Asia. So this is a really great topic because you kind of nailed it in your introduction. These are the difficult patients that they're doing everything correct, right? And so what's great about the functional medicine perspective, and we teach this in the weight loss program, are there different ways that we can look into what's going on with them, right? You're mentioning the HPA axis. This is a big contributing factor to why they're not able to take off that weight. Like Dr. Asia was saying, right? And you're probably seeing this in your clinic as well. These patients are doing everything right, or they think they're doing everything right. They might be on a calorie restricted diet. They may be taking some supplements that they think are right, but they're still not taking the weight off. And they maybe even have gone to other practitioners and they say like their thyroid is normal.
Right, exactly.
You know, are you seeing this often?
Oh yeah, I totally see this often. The labs are all normal. The labs that are run, I'll say that, are all normal, right? And they're, like you said, doing
normal.
Right, exactly. And they're doing all the things. And so I think these patients are often excited and shocked when they come to functional medicine. They see how much and more in depth we're able to kind of pick apart the pieces and really give them some feedback on what could be those hindrances. So the HPA axis, like you said, is just one of those aspects. I know you guys teach more in the weight loss program as well about all the other culprits for this obesity weight gain scenario. So yes.
Absolutely. And, you know, this is a big part here is the stress physiology and how it contributes to weight gain. So let's jump into what that meaning is here. The reason why we want to go into this is it's not just about stress, right? We understand, and your patients understand, that stress is a contributing factor, but how, right? We're not, as practitioners in functional medicine or integrative medicine, we need to be able to educate them on the mechanisms on this, and then how we can approach it from a functional medicine or integrative approach on addressing these issues. So let's go into the number one factor here with HPA axis dysfunction. This is going to be stress physiology, how it contributes to weight gain, the cortisol picture here, glucose production, and then how that is contributing to fat storage. So let's take a look at an image, and this is going to help us better understand this connection. And what I would recommend that you do as a practitioner is take an image like this, download it, right? And this is what you would share with your patients as you are educating them on what's happening with them, why they're not able to take off this weight, right? A lot of patients, when we're working with them, they want to be explained these things. And this is why we're going through this information with you. So this is coming from the International Journal of Molecular Sciences. You can see all of the areas in red here: the stress, how it contributes to the HPA axis dysfunction, how it contributes to gluconeogenesis, how it contributes to hyperglycemia, and then into metabolic disease. So let's dive into this and show you exactly what's going on. When your patient is stressed out, or they're unable to handle stress, and this could be anything, right? A lot of patients may feel like they're not that stressed out, but their cortisol levels may be saying a different story. And this is why we dive deeper into their stress levels and we look into things like their cortisol levels. And we're going to dive into that even further for you near the end of this podcast here. But what's happening here is if they're not able to regulate their stress properly, cortisol is going to increase what's called hepatic gluconeogenesis. And this is going to raise glucose levels even in the absence of food intake. So this is one of the primary reasons why calorie restricted diets don't work, because you're not addressing the main issue here. And that one of the main issues is how they regulate cortisol. What occurs with cortisol imbalances and how it triggers glucose and the raising of circulating glucose is that extra glucose, it doesn't disappear. But your patients might be wondering, where is this glucose going, right? It's going to often trigger higher insulin output, especially with individuals who are already prone to insulin resistance. Then that insulin is going to promote lipogenesis. That is the making of lipocells. And then that is going to convert glucose into triglycerides. And then that storage of the triglycerides goes into adipose tissue, particularly in visceral fat. This is why with our patients who have imbalanced cortisol levels or elevated cortisol levels, and they're not able to manage that properly, and this is the majority of our weight management patients, we often see an imbalance in their cortisol levels. This is associated with abdominal obesity. And these are the types of patients where it's difficult for them to take off that weight, because even if they're on restricted diets, it's because they're not managing that cortisol response properly. And what's important with this figure here is that cortisol doesn't only act on the level of the liver and the bloodstream that we're seeing here. It's also acting locally within adipose tissue. And it's that adipose tissue that is going to express a specific type of enzyme. It's called alpha beta hydroxysteroid dehydrogenase type 1. That is a mouthful. That enzyme is going to convert inactive cortisone into active cortisol. And that happens directly inside fat cells. So this is the relationship between imbalanced cortisol, triglycerides, and storage of adipose tissues, and the inability to lose that adipose tissue because of that imbalance of the cortisol. So what's occurring here is that circulating cortisol level continues to be moderately elevated or moderately imbalanced or severely imbalanced, what we often see with our patients. Then there's going to be a local cortisol concentration that occurs inside the visceral fat, and this can be much higher. And what happens after that is that locally amplified cortisol is then going to increase adipocyte differentiation. It's going to promote more triglyceride accumulation. That becomes a vicious cycle. It's going to worsen insulin resistance within adipose tissue for our patients. And then it's going to create this self-enforcing, reinforcing loop of fat storage, metabolic dysfunction, cortisol dysregulation. And this mechanism is going to help explain why stress-related, more so in particular, cortisol imbalances or HPA dysregulation helps or really impacts the abdominal region, visceral fat. And because this visceral fat now becomes an active in endocrine organ, and it's not a passive storage. And that's when patients can gain central fat even without dramatic changes in calorie intake. So the clinical translation here is that you can think of cortisol effects at two different levels. There's a systemic effect. This is when there's increased glucose from the cortisol levels or the imbalanced cortisol levels. This triggers insulin to store fat. And then there is a localized adipose effect where cortisol dysregulation happens, where it starts to regenerate inside fat tissue, further expanding visceral fat. Once this loop is established, weight loss becomes metabolically harder for our patients. And this is what they're seeing, not because the patient lacks discipline. And we want to make sure we're stressing this with our patients. It's not necessarily, we're seeing that, right? Your patients are on a specific restrictive diet. They're doing everything that they can, but the weight isn't coming off. So we want to re-explain to them that this isn't really their fault, right? We want to go into explaining all of this information for them and then helping them assess it further and then addressing it from a functional medicine perspective. And this is going to really help us with addressing their central or visceral weight gain. We're also going to help them with addressing even imbalances in glucose levels, right? And this is how it's going to show up clinically for them as well. They're going to have excess visceral weight gain. They're going to have elevated fasting glucose or hemoglobin A1C. These are the type of patients that have fatigue. They may be really wired and tired at the same time. And they're going to have weight gain where they maybe were able to lose weight a little bit in the beginning and then it's plateaued. This is what we're often seeing with these types of patients. I see this in the majority of the patients that I see when I was working with weight imbalances, is that one of the main symptoms or signs that they're saying is that they gained weight. They're doing everything that they can. They were able to take off the weight up to a certain point, and then they plateaued. And even if they try anything, they're still at that same weight. And their dress sizes aren't coming down. And it's because this is a major contributing factor that we need to look at for them, even if they're doing everything right? Or what they're considering as doing right. So we want to address this further for them and assess this further for them. So let's jump into a pop quiz now that we've gone through all of that information. The question here is, why can blood sugar rise during stress even if someone hasn't eaten? Is it A, cortisol increases glucose production inside the body? Is it B, the brain releases stored sugar? Is it C, muscle releases glucose into the blood? Is it D, fat cells turn into sugar? I'll give you a couple of moments here. Now that we've gone through that information with cortisol and glucose, I'm literally giving you the answer here. You should understand what the answer is. And if you chose A, that is correct. It's cortisol increases glucose production inside the body. That's what occurs when there is an imbalance of cortisol-related stress.
Wow, that was a phenomenal breakdown. I mean, I think the fact that you just educated us on, adipose tissue being an actual endocrine organ and not just being passive, adipose cells or fat cells on the body. I think that's so important to know. And I don't think that we typically think of it that way in general. Patients, it's not an actual organ. It has functional capacity. And then just the breakdown of, you mentioned that cortisol acts in the liver, acts in the bloodstream, but it also acts in the adipose tissue, right? Causing expansion of the tissue. So it's so important, this HPA axis, and trying to get that into balance as best as possible for these patients. Even more so, that was a wonderful breakdown. Thank you so much for that.
Yes. And we often see, in the clinical setting that these types of patients, when we look into the HPA axis dysfunction for them, that plateau starts to move.
Yeah.
Right? They start to be able to take off that weight because now we're starting to address one of their main contributing factors, which is this HPA axis dysfunction that we're talking about here.
That's right. Wonderful. Thanks so much. So now we're going to jump into just another factor, which is kind of related to stress, appetite changes, and cravings, which are huge areas for our patients as well. So we know stress, and I feel like most of the patients I see and have seen I can probably count on 2 hands how many people say, oh, my stress is low, I have no stress. Most people are highly stressed, or they'll say moderately stressed. Or what I find is they'll say, oh, I feel like I have normal stress. I don't know what that means, but normal stress. And then they'll say, I think I do okay managing stress. So there's stress, and then there's stress management, and then all the factors in the body that play a role in stress, the HPA, and how we're actually supporting those things, and so many little nuances that go into properly managing a stress response. So like we mentioned in the beginning, it's not just about meditation or, mindfulness. There's actual physiological changes that are happening and things we need to be thinking about for our patients. So stress is not just affecting how much we eat, it's also affecting what we crave and why. So these glucocorticoids are going to interact with insulin and our reward pathways in the brain, increasing the drive for highly palatable foods. So mostly those are like sugary and the fatty foods. These foods are going to temporarily dampen that stress signaling, which is going to reinforce the behavior. So essentially what's happening is we are teaching the brain that sweets and comfort foods function as a coping mechanism. So let's take a look at this picture from, I think it's a book, Recent Advances in Obesity in Children. This was published in 2016. This image is going to illustrate that cortisol acts directly on the brain's reward and appetite regulation systems, not just on metabolism. And so when the cortisol is elevated, what's happening in the brain, we're stimulating the reward pathways, including dopamine and even opioid signaling, which is really powerful. The dopamine opioid picture, really potent there. And then we're going to also be upregulating that neuropeptide Y, which is increasing the appetite and food-seeking behavior. And then elevated cortisol is going to also cause dysregulated insulin and leptin signaling, which is reducing the normal appetite suppressing and reward inhibiting effects. And so these are just such important bullet points. And, there's such a cortisol craze now on social media. Everybody's obsessed with cortisol, which I think is wonderful. But I also think as practitioners and functional medicine providers, it's our duty to inform patients and the people we work with, our clients, specifically how these things are impacting the body, so they just kind of absorb it on a deeper level. So I talk to patients about cortisol and stress, but I'll tell them cortisol does all of these things. So, the stress is just one aspect of it, but cortisol is actually acting on our brain and changing around our brain neurochemistry, right? So that's dopamine, opioid signaling that's being altered. That's appetite, food-seeking behavior. That's, we're reducing our normal appetite suppressing and reward inhibiting effects. So it's actually causing us to not have that control that we typically would have over what we're choosing to consume. So the hormones, the cortisol, is actually impacting our behavior as well. So as a result, the brain is going to become more sensitive to reward and less responsive to satiety signals. So when you're full, it doesn't really feel like you're full, so you kind of seek more food. So you kind of get into this pathway where you're driving metabolic dysfunction through brain chemistry caused by cortisol. So the brain also becomes biologically primed to seek out foods that provide quick pleasure and stress relief. So all the junk foods and the things that taste really good but are not really good. So this is going to create a physiological environment where energy dense, palatable foods, especially those high in sugar and high in fat, they're disproportionately appealing, particularly under chronic stress conditions. And I think we all can say, like, when we've been highly stressed, we're not looking to make a fabulous salad with protein or a piece of baked fish. We want some French fries, we want some potato chips, we want some chocolate chip cookies, that's the mechanism, right? So what does this mean for your patients? What it means is that stress is going to cause increased appetite, even when they've already met their energy needs, right? I'm still seeking something out. It's going to cause a shift in your food preference towards the comfort foods, right? So the fried, dyed, laid to the side things that we probably don't need. And then reinforcing that emotional eating through learned reward pathways. So we kind of just go back to those same types of foods because that dopamine opioid picture gives us that hit, right? And then over time, this pattern becomes conditioned, which means you just kind of get into the loop of it. The brain begins to associate stress relief with eating, not actually being hungry. And then what patients commonly describe is they have a strong craving for sweets, especially in the evening. I had like people will tell me, I have people actually, the patients that'll say like, oh, I keep a little nightstand. I'll keep little candies in my in my nightstand. So if I have a little craving for sweet, I can just lean over the bed and grab a little sweet treat. Snacking when mentally overwhelmed. This is something that I see a lot of patients doing, just kind of something to do. So snacking when you're overwhelmed instead of, being actually hungry. That's kind of that cortisol picture. And then a desire for crunchy or salty foods during periods of stress, which is a common clinical pattern, though most evidence supports palatable foods broadly rather than salt alone. So reviews consistently show that chronic stress is associated with increased intake of energy-dense foods and dysregulated eating behaviors, which is going to support everything in this image that we're seeing in figure 3. And even more so, I think that I'm glad that they showed a pediatric picture because we're seeing so much metabolic dysfunction and HPA axis dysregulation in pediatric patients. And so if you do work with pediatric patients, maybe this is something to really kind of drive home in helping that cohort out. And then just practical tips for us as clinicians and patients. You want to encourage protein earlier in the day, right? It's going to help stabilize the appetite signaling and also stabilize the blood sugar picture. Address the sleep debt, which is DEBT, D-E-B-T. That's what I'm saying, sleep debt, which is going to amplify cortisol-driven hunger. So think about sleep hygiene, things of that nature. We want to teach brief stress interruption tools before snacking. So before you go reach for the salty chips or whatever that thing is for the patients, maybe getting up and going on a little walk, getting some sunlight into the eyes, going on a fresh little bit of breathing, a fresh walk, getting outside, that can really help as well to kind of reorient that signaling. And then also modifying the food environment to reduce automatic stress eating. So a lot of my patients, I'll just tell them like, if you don't have the motivation or willpower right now to avoid it, don't even buy it. Like, don't even bring it into the house. So if you have to have something sweet, you have to get in your car. It has to inconvenience you. You have to drive and get it. You have to sit there. You can't bring it home. So just try to make it a little more challenging for you. So if it's not in the home, you actually just can't eat it, kind of thing. So yeah, I would say those are some of the just gentle strategies to consider for our patients. But I would say use this section as a way to describe to patients how, also I think it takes off the guilt too for patients who often feel bad about kind of where they're at with their metabolic health. Like, it's really a lot of chemistry and brain chemistry. It's not necessarily an issue of willpower. It's just, hey, your brain chemistry is actually pushing you towards these things. And so there was this really cool podcast I listened to years ago, and they were saying how they did this study looking at the addictive nature of things like chocolate chip cookies compared to like drugs like cocaine. And they found in some people, chocolate chip cookies gave the same like brain response as like doing cocaine, right? Which it means it's a really addictive thing. So it just goes to show how that dopamine and opioid picture and that cortisol piece can all tie into our foods, and they can really drive some physiological issues for us and metabolic dysfunction. So with all of that, let's jump into our next pop quiz. So stress-related eating is often reinforced because it A, improves digestion, B, lowers cortisol immediately, C, activates reward pathways in the brain, or D, reduces insulin levels. So do a few moments and then we'll answer this one, but there's only one right answer, which I think all of you will get right. So if you chose C, you are correct. Stress-related eating is often reinforced because it activates those reward pathways in the brain. So that dopamine and opioid picture there. So I hope that section was useful for some of us, and we'll kind of have some new clinical points to talk to our patients or our colleagues about. So
I'm glad you explained this because so many of patients thinks it's them.
Yeah.
Right? And their willpower, as you mentioned. It's not.
It's the brain. It's really.
It's in their physiology.
Exactly.
It's that dopamine hit.
Exactly.
Right?
Yeah.
And how often have we gone into that spiral, into that pattern where you're like, I am just craving those chips.
That's right.
But understanding this, that's powerful in itself. And just being aware of this pattern. A lot of times when you educate your patients on things like this, you can tell them, hey, when this occurs, I want you to see this pattern. right? And
Yes.
understand that this is a pattern from your brain and your dopamine responses,
That's
right?
right.
Just being aware of that and being mindful of that helps you kind of get all out of that loop. And then instead of grabbing for those chips, ensure you have some sort of protein snack
That's right. That's right.
beforehand,
I love that.
and just those small little things makes all of the difference for our patients. And so that was
100%.
a really, really great explanation on that. And then this is really important for us to educate our patients on this as well. And so now that we have gone into the reasons what's happening with the HPA dysfunction and how the cortisol is contributing to adipose tissue and the inability to lose weight, and then what's happening with the dopamine responses and those physiological responses, let's go into the clinical aspects here for everybody. And let's go into testing. I mentioned earlier that with HPA axis dysfunction, one of the biggest issues is that the patients have an imbalanced cortisol response, right? Even if they say they might not be stressed out, but they're not handling those cortisol levels, or their body isn't handling those cortisol levels properly. And so we want to go into how you can test for this. And one of the biggest ways to test for this, we often do this, Dr. Asia and I do this with many of our metabolic patients, is the salivary adrenal cortisol profile. This is actually a really easy test for them to do at home, and it's easy to send to the patient, and it gives us a lot of information. This is different than a serum sample, right? You may have had patients where they go and get their blood test, they might get a CBC, a CMP, and there might be an AM cortisol in there. That AM cortisol doesn't tell us a lot. And so I don't even go by the AM cortisol numbers. When I'm looking at cortisol, I actually want to take a look at salivary adrenal cortisol. And the reason for this is because we're taking a look at their cortisol patterns throughout the entire day. And this is going to help us identify things like evening cortisol, afternoon cortisol, if there's a flattened curve, where they're at in the phase of their HPA axis dysfunction. And this is really important to understand that, so you understand the treatment approaches, because there is going to be a different treatment approach for each phase that they're in within their HPA axis dysfunction. Is also going to determine what their cortisol awakening response is. And this is going to really depend heavily on timing and patient compliance. And this is going to be really beneficial to ensure that we're explaining how to do these cortisol testing for your patients so they remain compliant with this testing. And again, this is about pattern recognition. It's not necessarily meant to diagnose what is going on with them. It's meant to bring this into more of a clinical context. And this is going to help us understand where the HPA axis dysfunction is. It's going to help us understand where their imbalances are in their cortisol. It's going to help us target treatment approaches for them. And we dive into all of those main aspects in the functional weight loss program. We're going to be giving you some insights into some treatment approaches to help with cortisol responses, but this is a great tool that you can utilize with your patients. And this is going to help us really amplify one of the primary factors for their weight imbalances, which is sleep. And with sleep, what I often see in the clinic is the patients who have some sort of insomnia or some sort of inability to sleep, and because of that, they're not able to take off the weight. It's because they have imbalanced cortisol levels. I see this in both aspects where they have cortisol spikes in the evening time. I also see this with patients who have flattened cortisol curves or with patients who have imbalanced cortisol curves as well. Oftentimes, I will see that their sleep will be disturbed. And when that occurs with poor sleep, what's going to happen is that it's going to continue to imbalance their cortisol. It becomes a vicious cycle. It's going to worsen insulin resistance for them. It's going to heighten appetite and cravings. And it's going to go back to that physiological response that Dr. Asia was talking about, and those dopamine responses, or your physiological response making you want those dopamine responses, right? And having those cravings. It's because the HPA axis is imbalanced, their cortisol is imbalanced, and their sleep patterns get disrupted, and it becomes this vicious cycle. And then it's going to directly continue to affect HPA axis regulation, and it's going to continuously impact their inability to lose weight. This is why addressing, or actually assessing, where their cortisol levels are at is going to be really helpful to address one of the major contributing factors to their inability to lose weight, which is sleep dysregulation, right? So we're kind of handling two issues at once here when we're looking at cortisol levels, right? We're handling what their cortisol imbalances are. We're also handling one of the other major contributing factors, which is their sleep imbalances. And when we're using a functional medicine approach, we're often using a multi-pronged approach, because we have to handle all the major contributing factors for them to really get a response. And this is why we often see more complex cases with our patients, and we want to address the majority or the primary contributing factors to really drive that response for them, so we can get them out of that plateau and get them into getting to their health goals. Now, that is going to be really powerful as a tool and as a resource for you in functional medicine or integrative medicine. And this is going to be really helpful, especially with metabolism and your weight loss patients. So now that I've gone through testing, Dr. Asia has gone through some of the physiological explanations as to the dopamine responses, and we've gone into some of the cortisol responses and why the patients are holding on to the fat. Let's go into another pop quiz here. So this quiz question: clinically, improving sleep, what I just went through, often leads to better weight outcomes because A, it increases exercise tolerance, B, it reduces calorie absorption, C, it improves hormonal regulation before diet changes, D, it eliminates cravings completely. I'll give you a couple of moments here. If you answered C, that is the correct answer. When you are looking at sleep, right, it's that handling two aspects that I was discussing earlier. This is going to help with improving hormonal regulation, in particular, that cortisol, which can impact your blood sugar regulation and other hormones. And this is going to help with improving their overall metabolic picture. So now that we've gone through the whys of everything, the hows of everything, let's go into some treatment approaches. And then we've gone through some testing, right? Because that's a big proportion of what we do as functional medicine and integrative practitioners.
Yeah, I love that you mentioned the salivary cortisol. I think it's such a wonderful way to see, like you mentioned, throughout the day, what that pattern looks like. So you can see from morning to night where someone's levels are flat, just not actually no stimulation at all. So I think that's a really valuable test. If you're curious, that's the one I would recommend, like Dr. Chil would recommend, I'm sure, the salivary cortisol test. So
and
take
how
that.
often have we run those tests on our weight loss patients? I think I run it on probably 95 to 100% of my weight loss patients.
And how many of that percent would you say do you see with like the perfect, beautiful cortisol like curve, would you say? Or how many?
That is like 2%.
Yeah, exactly. Yep, exactly. So I think it's such valuable objective information, and patients can actually see for themselves, oh, wow, my cortisol is dysregulated. So really great clinical pearl there. So thank you for that. Okay. Let's hop into the last component, which is going to be treatment strategies, like Dr. Chil mentioned. So we're going to talk about two different botanicals here. We're going to talk about ashwagandha, and we're going to talk about gymnema, which is a really nice botanical for the metabolic picture. So ashwagandha, botanical name, Withania somnifera, is commonly used for stress and cortisol regulation. It's considered an adaptogen. So in botanical medicine, you have the adaptogen category of botanicals that essentially help your body adapt, if you will, to the stress. And it helps to modulate your body's response to stress in different ways. Various randomized controlled trials in chronically stressed adults show that standardized ashwagandha extracts can reduce perceived stress, actually lower that serum cortisol. So when we hear the lowering of the serum cortisol, we're thinking less cortisol to stimulate the liver production of fat, less cortisol hanging out in the serum, and then this less cortisol to actually get to the adipose fat tissue. So we're turning down the volume on a lot of those things just by lowering that serum cortisol, which can be really helpful. So when you talk to your patients about using adaptogens such as ashwagandha for cortisol lowering, make sure you drive home those mechanisms of not just, oh, we're lowering cortisol, we're lowering the stress. We are lowering how cortisol is impacting adipose tissue. We're lowering how cortisol is going to impact the liver, things of that nature. So also ashwagandha has been shown to improve overall stress resilience. So that's kind of the adaptogenic picture, helps you adapt to it so you're not as impacted by the stress. So the common study doses for ashwagandha is around 240 milligrams a day of a standardized extract, or 300 milligrams twice daily. It really depends on the formulation. So I would say if you have brands that you trust, there's some really great reputable brands that I like out there that just make really great ashwagandha or adaptogenics formulas. There's Gaia, Designs for Health has some really good ones. Dr. Chil, I'm sure, has his favorites as well. But I would say there's some really great companies out there for standardized botanicals. And then you have Gymnema sylvestre, which is a tongue twister, but it's a really popular one in the integrative space, at least I know in the naturopathic profession, this is one we learned about a lot, for sugar balance and sweet craving. So not only are we doing the ashwagandha thinking of how to support this person's stress response and that cortisol picture directly, but now we're also going to loop in a botanical to help turn down the craving of sweets, right? So we're kind of trying to work it from a few different angles. So Gymnema has been shown to reduce sweet taste perception. So it helps to turn down the taste buds for sweet. And then it also decreases the desire and intake of sweet foods. And it's also supporting glycemic regulation. So it's really just a nice botanical for targeting the craving picture, which is a huge driver of kind of metabolic and then also driver of that dopamine opioid picture. So we're turning it down in an indirect way by reducing kind of how our body even responds to sweet perception. So Gymnema is a good one. And then you can also consider like an adaptogenic botanical like the ashwagandha. And some formulas do have combination where they may be there together. But I can't, off the top of my head, I can't think of anything like that. But I'm sure there are botanical formulations where they're combined. So you may kind of get 2 for 1, depending on which brand you're going with. So a randomized trial in free-living adults demonstrated reduced discretionary sugar intake over a short intervention period with Gymnema. This is particularly helpful for patients with cravings where the cravings are more intense under stress. Another study published in Endocrine, Metabolic, and Immune Disorders Drug Targets in 2017, that's the journal name, adults aged 30 to 60 years old with metabolic syndrome who took 600 milligrams per day of Gymnema sylvestre extract for 12 weeks, right? So what's that, 3 months, experienced an average weight loss of approximately 3.4 kilograms, which is about 7.5 pounds, compared with no weight loss in the placebo group. which is really fabulous, right? So thinking about how potent the Botanical can be for turning down that craving picture and how that translates over to 7.5 pounds of weight loss in a 12-week period. And so we're going to include the study here if you're interested in reading more about that. But yeah, these are two botanicals that I think are really simple options to consider, along with all the other things we're doing, the cortisol testing, the all the sleep hygiene support, maybe the integrative components you're adding in, the protein hacks you're adding in for them, and changing up their lifestyle and diet. You can actually add some specific botanicals that have clinical data and evidence-based data to support how they're acting for your patients and what the goal is for those patients. And so let's pop. I think we have one more pop quiz. Let's pop into our last pop quiz. So Gymnema sylvestre is best known for which primary effect? A, increasing insulin secretion rapidly. B, reducing sweet taste perception. C, enhancing fat oxidation. Or D, stimulating appetite. The correct answer is, I'll give you a few seconds. Correct answer is going to be B, reducing sweet taste perception. So that's our class. I hope you found this information really useful. Maybe got 2 or 3 clinical pearls you can use, maybe cortisol testing, maybe some botanicals, or just new ways to describe these things to your patients so that the concept sticks a little bit more. We hope you enjoyed the class. If you want to learn more about the root causes of weight gain and weight loss strategies that can actually improve your patient's health, we are starting the functional weight loss program this week with the new class for the functional weight loss program certification. It's live and on-demand training every Wednesday evening. And we're going to talk about how all of the factors that contribute to weight gain, such as gut issues, immune issues, hormone imbalances, metabolic dysfunction, environmental factors, can contribute to weight gain. It's an 8-week certification program. The class started today, but you can still join it. So we'll add the link in the chat. So if you're interested in learning more about this class and, to join the class, you can just click that link and check that out somewhere. It's a really wonderful class that the Academy has put together. Really evidence-based and great information in there that you can, use same day for your patients. So yeah, this was wonderful. Thanks so much, Dr. Chil, for being on tonight. It's so lovely when we get to kind of hang out and do a podcast together.
Absolutely. And thanks for having me. I love doing these podcasts with you. We don't do them often, but it's always a fun time.
Yes. I think we have a couple questions in the chat. Let's see. So I need to know why SSRIs cause weight gain and what to do about it. I'm on Prozac and Buspar. My anxiety is well handled. I've gained 20 pounds. So I was digging a little into this one while we were doing some notes while you were chatting. So if you want to answer, you can. If you want me to, I can kind of just take a little dive.
Yeah, we can actually both answer, right? So one of the major side effects of SSRIs, actually one of the primary side effects, is weight gain. Here is the thing when we're working with patients on SSRIs or medications of the like. A lot of times when we are using a functional medicine approach, we're looking at all of the body systems, right? And then we're optimizing all of these systems for them. So when we optimize all of these systems for them, what typically we see happening is that their SSRIs or other medications become more effective. So then they have to take less of that. And because it's such a major side effect of the weight gain, when they start to take less of it, they actually start to lose more weight as well. So we're kind of, again, handling everything more from a holistic perspective here.
That's right. I would agree. Ditto what you've mentioned. I would say there are also some studies on SSRIs impacting the microbiome and reducing certain lactobacillus populations, which can contribute to altered metabolic dysfunction. So there's tons of studies around microbiome dysbiosis and weight imbalances. So it could be a little bit of all the things, to be honest with you. But yeah, there's definitely some studied mechanisms there for how those can contribute to weight gain. And then which test do you usually order for salivary cortisol? I'm familiar with the ZRT labs. Anything you would include?
Doctor's Data is really great. Dutch Labs is really great as well. We typically, with our practitioners in the program, we typically recommend companies such as Avexia Diagnostics or Rupa Health, because they house many of these specialty labs that functional medicine and integrative medicine practitioners use. So you don't have to set up an account with every single specialty lab.
Right.
You can just go to Avexia or Rupa Health. You look up adrenal testing or comprehensive adrenal testing or HPA testing, and many of the specialty labs should pop up for you.
Wonderful. Thank you. Thank you. All righty. Well, thank you, Jacob, our media team, for always just coordinating everything and making it so seamless for us. And then, yeah, so if you have other questions, you're more than welcome to reach out to us, set up a clinical coaching call or business call. I would say also, log into your platform. There's also modules there for learning about the HPA axis, cortisol, adrenal health. And then again, you can still join the weight loss, the functional weight loss certification program. The first class started this week. Alrighty, and then let's see. Okay, another question: who should not take Gymnema or ashwagandha? I would say, if I have patients that more so are like on the hypoglycemic scale, or maybe have like which I rarely see, like type 1 diabetics, if any, but I probably would be cautious about Gymnema for that clientele or that patient cohort. I usually am okay with recommending it for most of my metabolic cohort, unless they have some just obvious allergy to the botanical or sensitivity to it. With ashwagandha, what do you think about ashwagandha, Dr. Chil?
Yeah, at times ashwagandha can be stimulating, and so I use a lot of caution with ashwagandha for my autoimmune patients, right? It's a double-edged sword with ashwagandha and autoimmunity, right? Because there are some studies and some patients where it helps. And then there's some studies and where some patients where it aggravates.
Yeah.
And so you have to really be cautious with that. And you have to really take into consideration their past medical history, all of the other drugs that they're on, and then use a drug interaction checker. Yeah. Or use things like the NIH, right? You can just log in or look up NIH, Gymnema, ashwagandha. It's going to go through the drug interactions, what the contraindications are, and what the cautions are.
Nice. Thank you. All right, everyone. I think that's all of our questions. Thank you so much. It's been a lovely class, and we hope you guys have a good rest of your evening. And let us know if you need anything.
Bye, everybody. Good to see you, Dr. Asia.
You too.